And China is shifting its focus to people who have COVID-19 but don't display any symptoms. 130 cases have been reported today. This is the first time the national tally is taking those asymptomatic infections into account. A closer look now at how China is counting its cases with Professor Martin Hibberd. He's Professor of Emerging Infectious Diseases at the London School of Hygiene and Tropical Medicine. Professor, they didn't think that this group posed much of a risk at first. Why has it taken China so long to add these asymptomatic cases to its tally?
Well, it may be a little late, but I think it's great that China is now looking at asymptomatic cases. This has been a missing component of the containment strategy, and is particularly important at this stage of China's outbreak, where the numbers are small and really they need to start thinking about preventing outbreaks forming again. There are two types of asymptomatic cases that we're talking about. One group is those that at early stage of the diseases, they're asymptomatic and then later on may show symptoms. And maybe this new category where people have the infection but then never develop symptoms.
And how will this new data then help us understand sort of the trajectory, if you like?
We do not yet know how many people have the COVID infection without ever showing symptoms. For other diseases, such as influenza, there may be as many as 10 times more people without symptoms than there are with symptoms. If this is the case with COVID, this will have a big impact on how we understand the outbreak. We'd have to change containment strategies. We will have a better estimate of the infection fatality rate, and there'll be, luckily, many more people recovered and immune than we first suspected.
Professor, is there then any indication of the facts about this, about whether people who don't develop symptoms pose the same risk to others as those who are obviously sick? Do we have any idea of that?
So, unlike SARS, COVID patients seem to transmit early in the infection rather than the later stages. So we know that people early in the disease without symptoms can transmit the virus very effectively. And this has had a big impact on our understanding of the process. So now we suspect perhaps in a similar way, there may be also those people that never go on to develop symptoms may also be able to transmit the virus. But really at this stage, we need more evidence to be completely sure of that. Although there's a lot of suspicion, we don't know that for sure yet.
And how can countries possibly prevent the spread of infections arising from asymptomatic cases, as we're going to need to have sort of more blanket testing on everyone?
So I guess the current lockdown procedures, taking place in many countries will effectively reduce asymptomatic transmissions as well as symptomatic transmissions. The problem comes when you try and lift those. Yes, and so we can only effectively do that when we can start looking for these asymptomatic cases, assuming that they are as important as we suspect they are.
All right, many thanks for talking to us this evening. Professor Martin Hibberd from the London School of Hygiene and Tropical Medicine.